Good morning, everybody. Doc Dave here again. Thanks for tuning in. I have an interesting episode today. Episode number 34 is on the hazards of alcohol. Now, the other day I did episode number 33, which was on the hazards of smoking. So if you haven't listened to that one, this would be a good combo to listen to because these are, events that we're exposed to somewhat regularly. And, smoking is, a very difficult addiction to break, as is alcohol. So I'm going to go over today what alcohol actually does to your body. What makes alcohol such a toxic substance that people abuse? And how do you prevent it to some degree, and how do you treat it in the end game? So the first thing is just a few little nuggets here. Your physician, when you go into his office to see him for your yearly checkup, there's usually a chart on the wall, and it'll tell you about your alcohol usage. And the limit of alcohol usage, or the acceptable amount of alcohol usage in somebody who's 21 to 60, is generally no more than 2 glasses of wine a day, which is usually 3 ounces a glass, no more than 2 8-ounce beers a day, or no more than 2 hard liquors a day, which is 1 ounce each. Now, you don't take all 3 of those. You choose you choose your devil there. But if you drink wine, you can kind of drink up to 2 glasses a day, up to 14 glasses a week, believe it or not. And there's generally 5 glasses in a bottle of wine. So you're drinking almost 3 bottles of wine a week, and that's kind of the acceptable, but the top of the limit that your body can really tolerate. And then the same with beer and hard liquor. So when you're over 60, then things change, and generally it drops by half. So instead of 2 glasses of wine a day, it's 1 glass of wine a day, or 7 glasses a week, or a bottle and a half a week. 1 beer a day instead of 2 beers a day, and 1 hard liquor a day instead of 2 hard liquors a day. So that's because, you're getting older. If you've been doing this steadily from 21 to 60, where you're having 2 glasses of wine every day, your liver is going to start wearing out. It's going to start developing some fatty liver cirrhosis. So the ability of your liver to detoxify the alcohol you drink is somewhat limited compared to what it was when you were in your 20s and 30s. So that's why they cut it in half. Okay, so what are the negative physical health effects from alcohol? Okay, we're going to start with the physical health effects, and then we're going to go into mental health effects, injuries, and financial problems, as well as carcinogens. So, the physical effects. Number 1 is the liver. Just like in the lung, you smoke cigarettes, the primary organ that gets affected is the lung. In alcohol, the primary organ affected is the liver. It's not the only one, because we're going to go over all of them, but the liver is number 1. And what happens to the liver? Well, when you drink alcohol, the liver is the detoxifying organ in the body. So the alcohol goes through the liver like everything else you eat or drink to most degrees. And there's an enzyme in the liver called alcohol dehydrogenase. And what that does is it breaks down the alcohol to other products, and some of them obviously are toxic products, and then they're excreted out of the system through the bile system and into the bowel and out through your bowel movements. Now, you're also going to urinate out alcohol as well when it gets broken down, and that's how the police, if you don't give them a breathalyzer, then you got to take a urine sample. Now, they're not asking for stool samples yet, but they will request either a urine if you refuse a breathalyzer or a blood alcohol. So that's the alcohol dehydrogenase. And what happens to your liver if you abuse the liver with more than the upper limit of normal usage of alcohol? Well, the first thing you get is inflammation of the liver. And inflammation of the liver leads to fatty liver. We've all probably heard that. And what happens is, as these enzymes are depleted that break down the alcohol gets stored in your liver as a fatty tissue. And so you begin getting a fatty liver, which is not good, obviously. Alcoholic hepatitis, inflammation of the liver from too much alcohol abuse. Fibrosis of the liver starts to scar down because, there's certain areas of the liver that have been abused so much that it starts developing scar tissue. And last but not least, obviously, is cirrhosis of the liver, which is, just where your liver starts to deteriorate to the point where it can no longer produce any alcohol dehydrogenase, which breaks, your alcohol down to acetyl acid and other products. So everything starts to fall apart in the liver at that point. Now, the other organs that are involved are your heart. You get high blood pressure from alcohol abuse, which puts strain on your heart. You get coronary artery disease from alcohol abuse, which can lead to myocardial infarctions or heart attacks. You get cardiomyopathy, alcoholic cardiomyopathy of the heart, which means that the muscles in the heart that contract the heart to pump your blood around the system become weak and saggy, and they don't function. The muscle doesn't function as well, so you're not pumping out the blood in an effective manner, and you're starting to build up, fluid in your lung and congestive heart failure, so forth. So that's your heart. Your heart becomes affected from alcohol, of course. Now, the third one, which is quite common, is your pancreas. Alcohol causes inflammation in the pancreas, is what we call pancreatitis. We've all heard that before. And the toxins just can't get excreted through the pancreas as the bile comes down out of the liver with the alcoholic byproducts. And the pancreas, these toxic products go into the pancreas and they start to eat away at the pancreas and cause inflammation, which will cause eventually, adult onset diabetes, because now you don't have as much of production of insulin, and the insulin being produced is somewhat, not as productive of a insulin as normal insulin would be. So you also get that dreaded pancreatitis, which is one of the most deadliest diseases ever. So you don't want that diagnosis, trust me. Okay, so that's your pancreas, pancreatitis. Now, number 4 is also very important, your immune system. It decreases your immune function in your system. It infiltrates your bone marrow, where a lot of your immune products are produced, and it causes weakness in your immune system, which will lead to many disorders, but a couple most common ones are pneumonia, not only just from bacteria in your lung, but sometimes you get an aspiration pneumonia. You drink too much, you fall asleep, you vomit, and you take a breath, and it goes right into your lungs. Aspiration pneumonia, very deadly. And tuberculosis, yes, that disease is still around, and it is accentuated by alcohol abuse and decreased immune system. A lot of us have TB, but we don't know it. We've been exposed to it. You get skin test that turns positive, but you don't have any symptoms. So if you've got the latent tuberculosis in your system and your immune system can't fight it, maybe your skin test is even negative because it doesn't even react to it, then you get TB. Number 5, digestive problems. You get gastritis. Your stomach just feels horrible. You start vomiting. You get a little hemorrhagic gastritis. You get alcoholic gastritis, which is hepatitis as well. And you get esophagitis. The alcohol just burns into your esophagus, and you get reflux of the acid, the hydrochloric acid in your stomach goes into your esophagus and causes all kinds of irritations. And basically digestive issues, constipation, diarrhea, whatever you may get. And number 6 is obesity. Alcohol has numerous calories in it. One glass of wine, 3 to 4 ounce glass of wine has 300 calories to it. So if you're drinking the standard 2 glasses a day, you're adding 600 calories to your diet. And you binge drink on 4 to 6 glasses of wine a day for some reason, there's your 2,000 calories a day, which normally all we generally need to keep the body working. So that's the physical aspect. Now you got mental health aspects of alcohol abuse. Depression and anxiety. Both of them could lead to suicide. So, that's, basically it. You're just depressed. And if you're not depressed, you're overly anxious. And, your physician obviously needs to monitor this, put you on appropriate medications, antidepressants, and anti-anxiety medications. Number 2, mental health, brain damage, increased chance of stroke. If you have high blood pressure associated with alcohol abuse, and you binge drink, which is anything more than 6 glasses of alcohol a day, you have a 40% chance increased chance by 40% of having a stroke. So that's, if it's not enough to tell you not to binge drink, again, over 6 glasses in male, over 4 glasses in female is considered binge drinking. Increase 40% your chance of a stroke. Now, number 3, injuries. Yes, you get injuries. You get a DUI, you get an auto accident, major injuries. If you don't kill somebody else, maybe you kill yourself, or you get major injuries, DUIs. Number 2, accidental falls. Your unstable gait. You get up from a chair and you're wobbling around and you fall and hit your head against the corner of a table or break a hip or any kind of major injury. Number 3, drownings. People drink, boats, big parties, you're out in the lake, even young kids, healthy kids, you fall in the water, you jump in the water, you try to swim, and boom, you drown. Because you can't control your bodily functions and your muscular synergy. Number 4, burns. You either cooking or something splatters. You're not paying attention. You start a fire somehow. You're smoking and drinking at the same time. A cigarette falls on the couch, starts a fire. Not a good scenario. Number 5, sexual assaults. Speaks for itself. Number 6, domestic violence. You get a rage, and you start beating on people, and it's chronic. It's, if you ever live around somebody who's an alcoholic or drinks, beware. Next type of disorder is financial problems. The expense of alcohol. Alcohol is not cheap. You can buy cheap alcohol, but it's still not cheap because you're buying it in such volume. If you're drinking beer, I don't know, a 12 pack of a case of beer could cost you, I have no idea. I don't buy cases of beer, but maybe $30, and you may drink that in a day or two. Or wines, or hard alcohol. That's not cheap stuff. And you can burn through your monthly budget pretty quick with that. Number 2 parts of financial problems is work performance issues. You got sick days are increasing. You're not showing up to work. You show up to work. Maybe you got a hangover. You don't look good. You don't feel good. You can't concentrate, can't focus. And, next thing you know, getting called in, out you go, out the door with your little box of goodies from your desk. And the last one I want to mention is carcinogens. Alcohol causes carcinogens. And the main ones are breast cancer, liver cancer, mouth and throat cancer, stomach cancer. So there you go. It's it's quite the toxin, just like smoking. I mean, two really bad habits. And, both of them you can really do. Smoking you really can't do in moderation because, even if you smoke a cigarette or two a day, it's not good. But alcohol, you can limit it. What's going on with prevention of alcohol abuse, especially in the millennial age group, is that they have mindful drinking. There's a big problem with wineries now because millennials are not drinking as much wine as the baby boomers and stuff were. So you have decreased wine usage in millennials, which is a good thing. And you got mocktails. Now, mocktail, everybody probably knows what a mocktail is, but if you don't, it's basically a cocktail without the alcohol. You get the fruit drink, you get the flowers, you get the everything that goes into a drink, but you don't drink the alcohol. And they have non-alcoholic wines now, non-alcoholic beers. So, there's a lot of alternatives for that age range and our age, my age range, the over 60 age range. How do you treat alcohol withdrawals? Because, people are eventually going to have to stop. And then they go into withdrawals because their body is so primed up for alcohol usage. And, it usually obviously takes your medical physician to be involved, counselors to be involved, AA to be involved, and, medications, very important. Librium, antidepressants, sedatives, IV hydration. You go in the emergency room, you're having withdrawals, whatever, they're going to put a line in the IV hydration with all kinds of vitamins, folic acid, thiamine. These are things that, your body gets depleted of when you use alcohol. So there you go. There's alcohol abuse, hazards of alcohol. So moderation, mindful drinking, mocktails, give them a try. Non-alcoholic beverages, give them a try. Try to keep your wine or your alcohol usage within the limits that they set for the different age groups. And hopefully this has been educational and helpful. Pass this along. This is another good one to pass along because everybody, one time or another, you're going to be having drinks and stuff, just like the smoking episode. This is good for your friends and family members and co-workers that have these issues. So, thank you for your time. Remember, I'm your friend, not your doctor. And I will be back again very soon with another interesting, informative, and educational and somewhat enlightened episode. So thank you.